we've come through the Heart Health Month of February. It's a time, as you know, when everyone, especially women, is being encouraged to focus on their cardiovascular health. Well, we mark this final day of the month with a look at the connection between your heart and mind. Stress is a known risk factor for cardiac disease. The American Heart Association points to stress and how each of us reacts to it in different ways, sometimes with poor health behaviors linked to increased risk for heart disease and stroke, including smoking, overeating, not getting enough physical activity, and being overweight. I talked with Dr. Megan Shabbing from Ohio Health Riverside Methodist, who says stress can lead to physical problems.
So for some people, that's headache. People can develop chest pain and have what they might describe as panic attacks. People can become physically achy, and certainly people are more likely to have cardiac events if they have a lot of stress in their lives and they're not finding a way to effectively manage that stress.
Chronic stress may lead to high blood pressure, which can increase your risk for heart attack and stroke. Dr. Shabbing and other medical experts recommend stress relievers like exercise. They say you can run, you can walk, yoga, even swim.
And I think for people who, feel that exercise isn't really feasible for them, then you've got to think about other ways to manage stress. Journaling, reading. Some of my patients color. I have a lot of people who just like to get out and meet with people or just talk to somebody and vent. And that can be either a counselor or a mental health professional like a therapist, or it can just be talking to your friend.
The American Heart Association also reminds us that we can manage stress by getting enough sleep. Adults need 7 to 9 hours a night. I'm looking at my friends here. Identify sources of stress and work with a healthcare professional that can help you find some other ways to manage your stress. But some real simple things there. Walking. I like the idea of coloring. When's the last time you, well, you have little kids. You probably color a lot.
Yeah, we're working on coloring in between the lines at the stress.
Hey, forget that part. That's half the fun.
No, the kids are doing great. I'm working on that still.
It's hilarious.
It's fair.
We'll work with
Fair.
you.
Yeah.
That's all right. Also, I could feel that side eye. I didn't even have to see it. I could feel the side eye.
It was the side eye of love. We all need to get more sleep.
You're right. You're right. Sleep is important.
Yes.
Sleep is important.
It is.